Next slide, please, Tom. Our speakers today, so I just introducing and rounding up. So I work at VONNE. I'm the Health Partnerships Manager and lead on the Healthy Communities and Social Prescribing programme. And then we're going to hear from two speakers from two of the organisations that are part of our infrastructure investment programme. So that's directing money funded by the ICB into social prescribing capacity building. And that happens in a number of ways in different areas, depending on local needs. A lot of the time that is through investment into people and roles, but this webinar is going to have a look at the role of digital systems and platforms. And we're going to hear from two projects that have been kind of building those platforms in their areas to support social prescribing. So we're going to hear from Nicola and from Helen about what Northumberland Thriving Together have been doing with their frontline system. I can't help but when I hear frontline, I always think of dog flea treatment, but I think it's different to that. So that's one. And then Charlotte will tell us about Inspire Size Tyneside and what they're doing with their Plinth platform. So it'll be interesting to kind of hear about what's going well and what's maybe still needs development, and what they're kind of what the benefits of these systems are for social prescribers and people working on community support for people. Yeah, so I don't think I need to say any more. I can hand over to who's going to go first. Is it Nicola?
It is, yeah.
Yeah, great. Thank you, Nicola.
Yeah, that's great. Thanks, Tom. So good afternoon, everyone. Thank you for inviting me to talk to you all today. I'm Nicola Duffy, Programme Director for Thriving Together, and I'm joined by my colleague, Helen Andrews, who's one of our community connectors. Our team is part of Citizens Advice Northumberland, and since 2021, we've been commissioned by Northumberland County Council to support the voluntary community and social enterprise sector across the county. Can we go to the next slide, please? So Thriving Together's core mission is to bring the VCSE sector together to make a positive impact on the lives of Northumberland residents, and also to allow the smallest voice in the third sector to be heard. We achieve this through our community connectors work by supporting and building thematic and locality-based networks, collaboration, and holding networking events across the county. We also have a newsletter that goes out twice a month to over 500 individual subscribers and an active social media presence. And we provide VCSE representation with strategic partners, including Northumberland County Council, ICB, and other statutory bodies. Next slide, please. And as part of our commission, we promote Northumberland Frontline, which is a free, secure health and wellbeing referral platform and online directory. And I chair the steering group, which is a joint effort between ourselves, the Frontline team, Northumberland County Council, ICB, and other VCSE colleagues to lead the development of the platform in Northumberland. And I'll now pass over to Helen to talk more about the functionality of Frontline. Next slide, please.
Thank you, Nicola. So Frontline was originally co-designed 12 years ago by the VCSE sector and health local authorities, and was first used in Essex. Since then, it is now available in Essex, Northumberland and Herefordshire. The platform is free for organisations to register on and to use. It is the option to produce monthly and quarterly reports for its commissioners. Next slide, please. Frontline is in its 4th year and is funded by the NHS North East and North Cumbria Integrated Care Board and Northumberland County Council. The image on the right shows the landing page of the Northumberland Frontline website. It gives the option to search via the map, which is split between North, Central, South East and West Northumberland, or the other search option is typing in the help needed and postcodes. When each service registers with the platform, they select keywords, which describes the service offered and helps the user easily identify suitable support options. So, for example, Citizens Advice will use multiple words to describe their various service options, such as debt, energy, advice, food banks, law, etc. There's quite a few. Next slide, please. The search results will open up on a library page, as you can see in front of you, highlighting any organisation that links with the keywords which you've requested. The library page shows a list of brief information from each organisation with the option to click on more details or refer. And next slide, please. This shows an example of looking for dementia services using the keyword dementia and the library page open. Once you've found the services, the options can differ if you're logged in as a professional or a public. If public, the options would be details and request a callback. For logged in professionals, the options would be details or refer. This allows social prescribers to refer someone through Frontline to another service. Once the referrals have been made, it is sent to the referred organisation and they will receive an email alerting them that a referral has been received. Next slide, please. Practitioners who have made the referral can keep an eye on progress on their own dashboards, as shown in this example, showing that all referrals are picked up. It's a quick one, that. Next slide, please. All referrals have a traffic mechanism on them, and these are monitored by the Frontline admin team using a traffic light system. If a referral has not been actioned within 5 days, Frontline will automatically chase up waiting referrals. This is again repeated on day 10. These emails are auto-generated email reminders. However, if still pending after day 10, the Frontline admin team will telephone the service to action. The exception to the 5-day rule is if a referral is made to a service that requires a 24-hour response turnaround, for example, a food or fuel crisis provider or rape support service, and the Frontline admin team will monitor for these. Next slide, please. Northumberland Frontline now has 422 registered services on it and 342 organisations on the library. They have had 4,624 referrals and over 25,000 signposts to services over a 13-month period between January 24 and January 2025. There's a little bit of diagrams for you. Next slide, please. I've always wanted to say next slide, please. You can see by the figures on the left that there's a wide range of services on offer, ranging from county council support, which is the most signposted to patient support groups at the bottom. Each organisation can register unlimited individual services, such as the county council has services ranging from housing issues to veteran support. Community groups can also vary. For example, there could be a local Parkinson's support group, a knit and natter group, or just a Friends of a Community Wood group, which all support health and well-being. The graph on the right shows at the beginning of the financial quarter 23-24 that searches around isolation were the highest. However, in quarter 1 24-25, weight loss was the largest search criteria, and in quarter 2 24-25, alcohol and substance misuse has shot up in searches. These stats demonstrate a need in the county and help identify any gaps in provision. Next slide, please. This is some quotes from Frontline users. Just nice to see what they like to say. And next slide, please. In late 2023, Thriving Together was approached by Northumberland County Council and asked to take on a list they had been complied of veteran organisations and looking to pulling this together into a network. It was decided after looking at veteran services on Frontline that there were only 4 services that covered veterans. As such, through 2024, I built up relationships with over 50 organisations from across the county, which range from the local Veterans Breakfast Club to larger organisations such as Walking with the Wounded. From this piece of work, we've managed to increase veteran organisations up to 14 on Frontline, and also launched the Northern Veterans Network last November, and will be led by Prudhoe Veterans Club with continued support from ourselves. And I'll pass you back to Nicola now. Thank you.
Can we just go on to the next slide, please?
Yes.
So just to touch on some of the challenges which we've encountered. So due to the recent electoral boundary changes, some of the postcode areas in Northumberland changed, and that created an issue with some of the map searches, meaning that not all of the services offered within some areas were being displayed. We fed that back to the Frontline admin team, who made the necessary amendments, and the system has now been fully updated. And that really shows the sort of working relationship that we have with the frontline team. So we always will take feedback from the sectors, and if there is any issues, they're fed back and then the adjustments can be made. And promoting the service has been a challenge. Northumberland is such a large geographical area, and just getting out to all areas to promote the service is an ongoing challenge. We use posters and leaflets when out and about at different events and forums, and we give talks to community groups. And you might recognise Helen in the photo that was taken during a recent talk for the Elderberries group at Annick Gardens. We also facilitated frontline information sessions, which were targeted specifically for the VCSE. And then we also had a different range of sessions which were targeted at statutory partners, just to provide that additional support for prospective users of the platform. And again, the frontline team are always on hand to help any new user become registered, ensuring they get the most out of the platform, but also ensuring that they're aware of the reporting side. And it's a real benefit to VCSE organisations to be able to show the amount of referrals they've had through the platform. It can really help when they're looking at applying for future funding bids, for looking at commissioning. That wealth of information that comes from showing the demand for their service, where the demand has come from, who's been referring into them, can really help with that. So it's really useful in that way. And we'll continue to look at future opportunities to promote the service wherever we can. And in terms of future plans, as I mentioned earlier, we have a frontline steering group which meets bi-monthly, and that looks at the strategy and planning of the platform. Currently, we're focused on working with health partners to add more of their services to the directory. Last year, we focused on the ambulance service and police and looking at those sorts of emergency services and helping them to become registered as users of the directory. And also we have a plan to engage with more residents to publicise the platform more for individual use to help promote the wide variety of health and wellbeing services on offer in the county, and hoping that will reduce some of the burden on the NHS. Next slide, please. And in terms of opportunities for you all to connect with Thriving Together and the VCSE in Northumberland, we hold quarterly networking events across the county, and so far they've been held in a wide range of localities such as Berwick, Morpeth, Blyth and Hexham. We keep the networking events deliberately very informal, encouraging people from organisations to move around the room and talk to each other, exchanging information and starting collaborations. And they're great events for anybody working as a social prescriber or in a connecting role to really see the range of services operating in Northumberland. Our latest networking event was held in January at the Newbiggin Maritime Centre, and we had over 100 people in attendance, which just shows how valuable professionals from the VCSE, statutory and private sector find the events. Our next networking event is scheduled for the 29th of April at Longhorton Community Centre. If you'd like to attend, please email us and I'll pop the details in the chat and we'll send you a link to register via a Google form. I would recommend registering early, as we had to create a waiting list for the last event just through being at capacity. Next slide, please. We also have our Thriving Together website, which signposts to governance, employability opportunities, funding opportunities and upcoming events. And earlier I mentioned our newsletter, and that's a great way of exchanging everything that's happening in the county. If you want to put anything in the newsletter, you can just email us at the admin address, which, as I say, I'll pop in the chat. And if you're not already signed up, please sign up for the newsletter, and you can do that on our website. Just search for Thriving Together Northumberland. Next slide, please. So as Richard mentioned, we're going to have time for questions at the end of both presentations. So please keep any questions until then and we'll be happy to answer them. And we also have Amy Rawson from the frontline team here, so she can help with any technical queries you might have. But for now, I'll pass over to Charlotte. Thank you very much for listening.
Thank you. So yes, I'm Charlotte Harrison from Inspire, and we're the local infrastructure organisation for the voluntary sector in South Tyneside. The platform we use, as Richard said at the beginning, is called Plinth. There's some similarities, so I'll skip over some of the things which are very similar to what Nicola's been describing. And instead, I'll also do a bit of a focus on the volunteering aspect of Plinth and how we're using that with social prescribers. But if you could just go on to the next slide, please. And the next one, thank you. So Plinth is, we've been using Plinth for about 2 years. It's only been sort of outwardly live in the borough for around year, 18 months. And the reason for that was that we deliberately spent time as Inspire trying to break it so that we knew every aspect of Plinth. It's still being developed. Plinth isn't something that we set up. It's run by, it was created by 2 incredibly smart guys in London, came out of COVID, and they're a startup tech company effectively, and they've been on a very huge sort of growth and development spurt since then, and that's had its benefits for us, but also some downsides, which I'll come to later. So we didn't join Plinth explicitly thinking about social prescribing. It was more about it being a free one-stop shop for the voluntary sector in South Tyneside to promote their services, their events, their activities, primarily initially to our residents, and the same for a one-stop shop for volunteering. What we have learned, I suppose, along the way is how it can also operate across the voluntary sector and statutory sector in a similar way to as is happening in Northumberland in terms of those referrals and connections. The mechanics of Plinth, I suppose, very quickly, is that Inspire is the subscriber to Plinth. So we pay an annual subscription to access the Plinth platform, and that means it's free for every voluntary sector organisation in South Tyneside to access. Now, by access, they can just use it as a standalone website, and I'll show you what that looks like in a second. But it also has other functions for, if you think about Inspire as the macro account holder, and all the voluntary sector organisations who are signed up have their own micro account in Plinth, and that provides them with access to a CRM system. They can deliver reports on it, they can access funding opportunities, they can, it's got AI capacity built in to do grant monitoring returns. So it has capacity building potential for the voluntary sector, as well as that being that one-stop shop in terms of residents. So I'm going to hopefully show you now what it looks like from a resident's point of view. And this is our community page. Hopefully this works, Tom. So this is what a resident or anybody in South Tyneside who wanted to have a look on Plinth would be able to go on to see. If you just scroll down a second for me, at the top right you can see 2 little tabs. One's map and filter. So if you wanted to, you could have a look at all of these activities, there are almost 600 on there, as a map, or you could filter them. The filters could be what day of the week they're on. So if you wanted just to see what was happening on a Tuesday, you could do that. Or it could be filters for specific types of activities, so children and young people. But these are these little tiles, a resident or another organisation can click through. So if you mind clicking through on Men's Shed. Brilliant. So I'm a resident or a social prescriber, and I'm working with somebody, like the look of this. I click through, and then if you go into book, it will take you through to another page. I can see, scroll down, tells me a little bit more about what's happening, where it's happening, and then you can see on the right hand side you can book directly onto the event activity. So Sensibility Matters will have the back office function of that, so they'd be able to see who was booking onto the events, and they could also send surveys or capture additional information. So as I said, initially we came at this as from the perspective of thinking about how we could promote this to residents. Like pretty much everyone else on the call, we don't have a very large marketing budget. In fact, the very large, almost minimal. And so what we are doing instead, in terms of promoting it to residents, but also seeing the additional value, is working with all those community facing teams, whether they're in the local authority, health colleagues, started engaging with schools and police, to anyone who's got a community facing role, to get them to see the value of Plinth being a referral route for them. Do you want to just come back out to the main page, Tom? Because hopefully that's given it enough of a view. So very similar to Frontline, you can make referrals through, and then you could, the host organisation, Sensibility Matters in this instance, will be able to capture how many referrals they're getting from social prescribers. This is very early stages of development for us in terms of the potential for different ways of reporting on referrals into the voluntary sector. But this is a live directory, so at any given time it's very varied. We're also using Plinth platform in South Tyneside for our holiday and food activities, and also for a food collective network as well. So we're starting to see how it could broaden out even beyond our sort of first impressions. A lot of this is very similar to how it's working together with Northumberland with Frontline. So what I'll do very quickly now is perhaps pop onto the volunteering page, if you wouldn't mind. So that gives an extra element to it, I suppose. What we have found actually is that as the Volunteer Bureau for the Volunteer Centre for South Tyneside, we have a steady stream of people coming in to volunteer, and any resident could go onto the volunteering page and register as a volunteer, and they can have access to all the volunteering opportunities, which again, if you just scroll down, you just get a selection of those that are live at the moment. However, what we realised with our data was that a lot of our main source of referrals for volunteers coming into Inspire was one of our primary social prescribing organisations in the borough, First Contact Clinical. And we've then started working with them to really understand how we might develop a bespoke pathway for volunteering for social prescribing link workers to use with their clients. And that's got two aspects to it. One is understanding the needs of the client group. So as part of that, our community connector who leads on volunteering is developing a guide to Plinth and volunteering that the social prescribing link workers can use with their clients. And then we're also thinking about how we can capture the reporting for volunteers that come through that bespoke pathway. So the same way that you can capture reporting on events and activities, the volunteering back office functions of the volunteering will enable us to capture volunteer hours, the training that volunteers have undertaken, and we can also starting to use impact and outcome measurements with volunteers, and specifically for the social prescribing volunteers pathway, we're looking to use the same outcome measure that's used across the ICB footprint called Dialogue. So we're hoping that will give some consistency of measurement. And so this, again, it's very early days. We're about halfway through developing the pathway. But what we're finding is that it's giving us a much better understanding of the needs of this client group in terms of volunteering, and making sure that they've got the support around them, and that the volunteering outcomes are more likely to be successful in the context of the work that they're doing with their link worker. So what we'll be able to do for individual, so First Contact Clinical can have a report generated that gives them insight into how many volunteers they've referred through to us, where they've been volunteering, and then the individual organisations will be able to code their reporting about the volunteer hours that their volunteers are doing, and they can see how many of those volunteers have come through that pathway. What Inspire, as that macro account holder for both the events and activities and the assets, the community assets and the volunteering, we'll have is that anonymised and aggregated up data. So we'll have the picture for South Tyneside. And for us, this is kind of one of the big strategic goals first that we hope to achieve with Plinth. There's huge operational benefit in the immediate and medium term, both for the voluntary sector, our statutory sector partners to feel more connected, and our residents, we believe. But in capturing some of that data that at the moment is very disparate across the system, we think it will give us, as the voluntary sector, a huge amount of really rich quality insight that at the moment isn't held in one place. And in terms of those commissioning decisions in the future, I think that puts a different dynamic in the sort of relationship between commissioners and commissioned organisations, because as the voluntary sector we'd have something very powerful to bring to the table in terms of understanding the impact of the voluntary sector and also the impact of volunteering. If you just go back to the slides, please. And then similarly to Nicola, there's a couple of things I suppose that we've been learning along the way. Would you just move on? I think it's about 3 slides. Yeah. So I mentioned that when we originally started out, we were thinking of promoting it to residents, and we are doing that, but we actually then pivoted to identifying those community-facing teams. It is like painting the fourth bridge, because what we've kind of recognised is we perhaps might go in and a team are like, yep, we're interested in this. We do the full training, but then we might check in a few months later and they're perhaps not using it, so we're having to go back. And that's fine, and Plinth is developing in the interim as well, so we can always add new things into that. The shared outcome measurements is a new thing for us, particularly dialogue, and I realise I've not used the right spelling on that. And that's something that we don't have any insight into yet about how that will work in terms of capturing that outcome measurement for link worker referrals into volunteering. The platform development has both pluses and minuses. I mentioned before that basically Plinth are a tech startup. They operate across the country, but South Tyneside was one of the first sort of areas to use it on an area-based approach. And that was, I think, gave significant learning to both us and Plinth in terms of the actual difference of working across a system. What that has meant is that we've been able to get tweaks and adjustments made, but obviously working with effectively a startup, they go through those periods of kind of growth and then kind of having to capture up with demand. So it has been a little bit highs and lows, but I think there is a strong partnership between us and Plinth, and we've already actually been speaking to them today about some new developments that we're going to be testing with them. So it certainly is an organic relationship, and hopefully one that will be in it for the long haul. I think I said at the beginning that we've been working with Plinth for about 2 years, but it's not been active in the borough that entire time, and I think it's probably going to be another couple of years before we start to see some of that strategic impact of having Plinth as this kind of resource hub for us, although we will hopefully see the operational benefits, both in terms of those community assets, but also volunteering. So I think that was it from me. Yes, it was. So I guess it's questions now.
Yeah, have we had any questions in the chat that we can respond to?
Nothing in the chat so far.
Yeah, do anybody would like to ask any questions or get a bit of clarification on anything? If there's, I'm not hearing any hands going up, but can I ask a question? I guess about how have you approached those people who might be maybe digitally excluded, and is there have you got alternatives or different strategies for them? Oh, Nicola?
Yeah, can I answer that from sort of a Northumberland perspective? I mean, it is a digital platform. So, and it is, via PC, but also via mobile. So there is that mobile app as well. I suppose in terms of digital exclusion, we're focusing more on the individuals, which, as I say, is sort of our second phase, if you like. In building the platform, we're very much focused on professional referrals, really more than individuals. So we haven't encountered so much of those issues digitally, because obviously professionals do have had access, so that hasn't been a major issue for us. But it is a digital platform, so that's really sort of the option that we've gone for. But in saying that, I think that there's just huge benefits, because it does make it so interactive, and it means that services can constantly update the library entries. So you don't have, as you do with the paper directory, where it just immediately goes, out of date, and people get frustrated because somewhere it's advertised as being open, and then somebody presents at a service and it's closed. You've got none of those issues when you've got the live directory, and it's really useful for services, because you can toggle on and off if you're accepting referrals, or if you then get to capacity, or you have a particularly busy period, or there's holidays or whatever, you can toggle off accepting referrals, but everything still stays on the library, so that when you then are in a position to then start taking referrals again, you can toggle back on. So I would say it is an issue, but I think more and more people are becoming digitally enabled with probably every sort of passing year. So it is an issue, but I still think it very much has a lot of advantages over the old sort of paper-based directories of the past.
Yeah. Charlotte, did you want to comment on that as well?
Yeah, I'd absolutely agree with Nicola there, that with the advantages of the it being constantly live and up to date. We have at the last count, which was a few months ago now, we had sort of over 8,000 South Tyneside addresses registered onto Plinth. So we know we are getting sort of resident take up and use. But that was also partly the benefits of sort of pivoting to that community facing teams approach to rolling out Plinth, because we thought we'd like to get it kind of Plinth being part of everyone's day-to-day practice. So the example we always use is if health visitors going out to see a new mum and baby, and the mum happens to mention she's not seen her friends much since having the baby, she's first one of a friendship group to have a child, then we'd hope that alongside the kind of professional clinical input that the health visitor could give, they might say, well, let's have a look on Plinth and let's see what activities and events and services are on near you, and we can refer you in. So we're hoping that kind of digital army of community facing teams will help overcome some of those initial challenges for people who perhaps are digitally excluded or aren't aware of Plinth. And then I suppose the other element to that is within the voluntary sector itself, thinking about how, when we're supporting running courses around digital inclusion, is thinking about how we can build Plinth into that as kind of a huge community resource and asset.
Yeah, thank you.
We've just got a question in the chat there. I'll just read this out. It's from Alessandra, just first thanking you for the presentations. Regarding the direct referrals, how many staff monitor those, and do you have anything in place to flag and manage possible access needs and safeguarding issues?
I don't know whether Amy wants to answer that on behalf of Frontline.
Yeah, happy to. Can you hear me all right? Yeah. Thank you. Yes, so services, as Nicholas said, each service on Frontline fully controls how it wishes to use Frontline, and it also fully controls its own content. So if they, from a service point of view, want to cover off in the first instance with any referrers, any potential safeguarding issues or access issues, then they can add those additional questions to Frontline's form so that those questions are dealt with upfront at the point the referral is made.
And just
Thanks, Amy.
from Flint's point of view, effectively it would be organisation to organisation. It wouldn't come through Inspire. So within the kind of micro account each organisation would have, you could have a network of partners, and then you can make secure referrals across that network. So it wouldn't go outside of the two organisations. And there'd be guidance on kind of how to use that and who has access. So an organisation that has an account with Plinth can set up as many people to have admin rights over it to use it, but you can also lock down notes and information that only certain admin users can access. So there are balances, checks and balances in that as well.
Great, thank you. I think there might have been another question, or might have been a comment to come through in the chat.
I think that was Amy's comment.
Okay. Yeah.
Amy, would you like to just make that comment?
Yeah, happy to. So this is relating to what about those that are limited in terms of having digital access. So we are always mindful that whilst Frontline is a website and an app, it doesn't necessarily mean that it's 100% inclusive. So on the Frontline Northumberland page, there is a telephone number, which in Northumberland's case is their Northumberland Communities Together team, who operate 7 days a week with a phone number there on Frontline if anyone prefers to speak to someone rather than make a digital referral for whatever reason.
Yeah, that's really helpful. Thank you.
I've noticed that Alexandra had a bit of another question in there as well. She said, how many staff monitor the referrals? From a frontline point of view, Alexandra, we have a really small admin team. We're not generally a technical company. We actually come out of the voluntary sector. That's where our origins are, in response to much of the issues that you've talked about today, which is how to connect the voluntary sector and all of its superb work to health and other statutory services so that people get that support early, ideally preventative support. So that's where we come from. So we have a really small, tiny admin team. And because it's a digital platform, we oversee through the traffic light system that Helen mentioned in her presentation. We can see very quickly every single day how every referral is panning through the system. And therefore, no referral on Frontline ever gets lost because we ensure that everyone gets a timely response. And the other thing that I wanted to flag was that, and again, this was mentioned, it's really, really critical for all of the voluntary services to evidence their impact and value, particularly when funding is so incredibly tight. How do you do that? You've got to produce the data to evidence the demand for your particular service, because money will follow. That's the world we live in. Frontline gives you your own dashboard when you log in. You can print off a detailed report into Excel of all of the services and how often they have been referring or signposting to you, so that you can evidence, look, how much the NHS is pulling on our services to support patients to get them out of hospital sooner, or to support patients not getting a GP referral. So all of the evidence is absolutely there for the services themselves to evidence the hard work they do.
Thanks, Amy. Yeah, Charlotte, did you want to come in on that?
Yeah, it was just building on that point, actually. It reminded me that one of the things that we're thinking of in South Tyneside is a data and insight strategy for the voluntary sector, which is a huge task in itself. But a couple of our organisations that are using Plinth and really maximising the reporting capacity in it are also integrating that data with other sources. So one organisation, Northern Rights, is using something called Signal. I don't know if people have come across it, but it's a poverty tracking system. And Northern Rights are working with people in South Tyneside who are wanting to get back into work, but are a long way away from the workplace. And one of the things that they're using Signal for is when they start working with somebody, they ask them basically what's keeping them up at night, and it's a red, amber, green type process. And they've captured some really interesting data and insight around the levels of self-esteem of some of the communities in South Tyneside. So they're able to sort of play around, kind of like calling it a little sandbox, with the data and insight that Signal is producing, and looking at the reporting that they're using from Plinth, and that's starting to kind of make us all a bit more data curious, which I think is a really powerful thing. So yeah, I was just building on the comments there, because I think the reporting capacity is great, and if it makes us think, oh, I wonder if we put this piece of data and this bit of insight together, what's that start to tell us? And particularly in terms of that sort of predictive understanding of, you know, population health management and thinking about more preventative interventions, then I think really kind of having a good play in the data sandpit is something that we're all up for.
Yeah, thanks. And that Signal sounds like it might be similar to the HEY system that Edward's House has developed, kind of looking at the social determinants and what's bothering people. Yeah.
We've just got another comment in the chat there from Kirsty, just a mention of Living Well North Tyneside, which is similar to Frontline. Just saying it'd be good to connect with you all to share learnings. So I'll check in with the speakers afterwards, and if it's okay, I'll share emails in a follow-up to this webinar. I think everybody's nodding. So yeah, I'll share speakers' emails.
Lovely, thank you.
Yeah, I think there are several systems, and I think there's Darlington, then Connect, I think down there, and I think Sunderland Links for Life. So there will be various versions of this type of work. Are there any more questions? I would quite like to understand, if possible, the balance of the administration work, because like with any kind of referral system or directory, there's obviously a lot of keeping it up to date. And so if I understand rightly, is that all with the individual services who are who share their information on the system? Are they responsible for keeping that up to date? And how much additional kind of admin work is there to maintain these systems?
I'm happy to answer there, Nicola, if you want me to pick that up. Charlotte, do you want to go first? Sorry.
Oh, that's fine. You carry on.
So the key is you really want to keep admin to a minimum where possible, because that's more expensive, of course. So Frontline is set up to be super simple to use, and as part of our terms and conditions, it's up to each of those services to update and keep their information up to date. We also, though, to support them with that, every 6 months we ping them an automated email. So it's all built into to Frontline on a sort of auto-generated basis to remind them, just have a quick look at your library page. Is everything all up to date? Are you keeping these opening hours? Tick yes or tick no to edit. So it's all really straightforward. And we also run reports on a regular basis to check that if a service hasn't got round to checking, they'll come up on our report and then we can give them a ring. But generally, because Frontline is a transactional platform where many of those services are in it every day, either receiving a referral or going into making a referral, they're actually seeing their own information on a regular basis. So often they can be sort of tweaking it anyway as they go on.
Yeah, in terms of Plinth, it is the sort of voluntary sector, the micro account holder will set up their volunteering opportunities or their services. We've created the formatting of that, so we've tried to make it as easy as possible. I think probably after you first go, you can set up an activity or a volunteering opportunity in less than a couple of minutes, if that. And if that, you could also just do it with a single line into the AI function, and it will generate the event for you or the activity. That then comes through to Inspire, to authorize, to put it onto our platform, if you like. We don't do anything that unless we kind of notice it might be illegal, or some when you're setting up your activity, if it's a recurring activity, you can have that, or you could pick specific dates, or if it's a one-off. So sometimes we might notice that people have done it, you know, a recurring activity, or it was a one-off, but they'd accidentally clicked recurring, so we can see that and either, you know, go on and amend it or check with them. But yeah, it's self-generating and minimal effort, I think, like we would say.
Thanks. I think there might have been another question came through. Can you see that, Tom?
I think no more questions
No.
in the chat, and I can't see any hands up either.
Yeah. Okay, we're going to finish on time, which is good. Well, thanks very much to all the speakers. That was really interesting and very clear explanations of the systems. We will share the slides, we will share the recording and the contact details so that you can have follow-on conversations afterwards. Yeah, and we will be in touch soon as well to let you know about future webinars. We're just at a kind of a transition period at the minute where we're not quite sure what the program is going to look like, but as soon as we do, we'll let you know. It would be really helpful for us if you wouldn't mind, as we close the meeting, if you wouldn't mind completing a short questionnaire for us. Again, it just helps us to make sure that we're getting good feedback on these sessions, and helps us to plan future sessions as well. So there is a link, I think, that Tom's going to put in the chat. So if you could do that on your way, that would be really appreciated. And yeah, thank you for coming along, and hope to see you again at another event. And also very interested to hear about any of your developments in social prescribing or in development of these systems. Okay, thank you very much.
Thank you.
Thank you.
Thanks.
Thank you. Bye-bye.
Bye bye.